Hello. This is Jonathan Munoz, and today I want to talk to you about the personal statement as we are approaching match day. And with that, for many, the good news of knowing where to start residency and what's going to happen to your life. And for others that may not had interviews or they had bad interviews and they're realizing how bad your interview skills were, it may be the chance to go to the SOAP process. So let's start with talking about the what can we do to to face the SOAP process with better chances. So if you think about that, you probably didn't have many interviews. You probably didn't have a good interview process. Why? Because something was lacking on your ERA CV or in your personal statement. And why? Because as I said before, two things. Once you are past the screening process, once you are past the selection process and we offer an interview to you, two things guide the interview process. One is your ERA CV and one is your personal statement. So I see before getting into the interview, I see quickly read your personal statement. If it's boring, I lose, I don't know, focus, I lose interest, and then I move quickly on your CV. And your ERA CV doesn't have something that catches my attention that is related to primary care, not to the subspecialty that you want to follow, but related to primary care, because I'm going to be hiring you to do primary care work. I'm not going to be hiring you to become a GI specialist or a cardiologist. At the core, I'm trying to hire you to get to be a good resident, to work for me as a good resident. So I need to know that you're able to do that. So a combination of these two papers are at this point where are going to drive the outcome of this interview. So I'm going to quickly say, okay, good guy on the personal statement, and it kind of sets the mood. To be honest, it sets the mood. If I read a personal statement that is so well made, there's such motivation, there's such commitment, there's a person that is so secure of his abilities or so so committed to the work that's coming ahead, and there is a track of good work in certain areas that are important to primary care, I will be very interested, and it probably will be the person that I will remember the most. Americans are very good at making personal statements. They are very good. So my first advice to this, if you are seeing yourself in this position of not having many interviews and you may go into the SOAP process, or if you are looking into creating your personal statements for observerships, for um, in, in, in preparation for the next cycle, application cycle, then I would say draft something and send it to a professional to edit it and add flow to it. Because I see this so many times of people that send me personal statements, especially from people like us that are MGs, that we like to start in a very poetic entrance, saying something about the death of someone, your misfortune, your tragedies in your life, and this is not something that really catches the attention of anyone. Nor is your how smart you are in I don't know, when you were a kid or when you were in secondary or in university, because there's no way for American physicians or American program directors to really if, have proof of that. To all they know, it could be something that you are just saying. There's no proof for them. Your records in your country have no meaning in here. But what has meaning is what you did with the same populations that you're going to be working here, like the less fortunate. So if you have a track history of working with people with less fortune than you for free, without care of you making any money out of it or not, then then I think, okay, this person knows about working with people with low incomes or with poor resources. So he probably understands what is needed for a person to succeed on their medical treatment. So, on your personal statement, and this is something new that you may not find on your Google searches or anything around, or even on those services that are working on creating personal statements, you may not find this recommendation. Why? Because this is new. This is just starting to happen over the last 2 years on how program directors are trying to look beyond what is on paper with the help of what is on the paper. Weird, right? Like trying to look beyond what's on the paper with the help of what is on the paper. Why? Because with the help of what's on the paper, we kind of guide the conversation and say, oh, it says here that you were volunteering in this shanty town in your country and you were in charge of, I don't know, providing the medications that the patients needed. How was this experience? And you explain, well, in my country, we get donations of medications to this church, and when patients are evaluated and a prescription is signed, then I was in charge of filling the prescription and explaining to the patient how this medication is going to be taken. During this time, I realized that many patients, even if you try to explain very carefully how to take the medication or how to use an inhaler, they don't understand, and this could be part of the reason why they failed their treatments. So one strategy that we implemented was to have a family member present during these conversations so they will know and understand how this medication should be used. We also had to implement I don't know, papers or posters for patients to take home and be able to read on how to take their medications. And this will show us that it helped on how they were doing with their management. Why? What does talk about? That talks about literacy, right? Literacy on the part of the patient to understand how to use a medication and to understand their disease process. So if you are able to mention things like that in a conversation, then you're good. You're in really good standing, guys, because in United States, many of the hospitals that you're going to be working at serve underserved communities. And with this comes the lack of health literacy, or very poor health literacy. So if you come with these innovative ideas on how to reach, how to fill that gap, you may be in a really good spot. So if your CV and your personal statement tell that story, instead of telling about the tragedies, or instead of telling about the misfortunes or your greatness during medical school, if you tell more about how were you early involved in the world of primary care, then you are getting my attention. So how do we do that, right? How do we start such creation? So first of all, let's try to stay away from the tragedies. You may bring up the tragedies at some point during the conversation. Maybe during the interview, someone asks you, so what, I don't know, how do you keep yourself motivated and driven during medical school? You could say, well, I don't know, since my father died, I made a promise of myself to learn how to treat diabetes and how to prevent the spread of, I don't know, hypertension or its complications. But I would suggest to reserve it to I don't know, the end, because medicine is a career, it's a war of bad news all the time. And I don't want to see more bad news. I want to see something enlightening, something positive. And I think the more positive you present yourself, the more likely the other person is going to be positive about you. Even if you have low scores, or even if you have I don't know, a very limited CV, then the more positive you become, then you, it's contagious. So I would say start with a short line about your beginning, about maybe the poetry that you want to add to your personal statement. Something short saying, my something I use is my path towards medicine started at the early age of X years, 8 years or 5 years when I used to sit in the corner of I don't know my house, watching the local doctor come to take care of patients in our village, and I always thought that he brought hope or happiness to the village that day that he was here, and since that day I made it a promise to myself to become a doctor to bring hope to others. And then you start with the body of this, and then straight go to during medical school. I put emphasis, I put big interest on managing chronic conditions. So key words, magic words, managing chronic conditions. Don't talk about the zebras, don't talk about the rare conditions, because that doesn't happen in medicine. I haven't seen rare conditions in 7 years of practicing. I haven't seen rare conditions. I see hypertension, diabetes, DKA, small bowel obstructions every day. I haven't seen something weird like, I don't know, emphysematous pyelonephritis. I haven't seen that. And I know how to treat it, but I haven't seen that other than in rotations in urology. But not now. So that's the reality of medicine. We have to really know the basics. So chronic conditions are the basics. So you explain how you put early interest on managing chronic conditions, and then you catch my attention. Why? Because chronic conditions are bread and butter in primary care clinics. Also, proper documentation of chronic conditions make for a lot of money that comes to that clinic. And chronic conditions, the documentation of chronic conditions also increase the severity and the degree of illness of a patient in paper. It is part of a scoring system that the healthcare system has. So proper identification and categorization of chronic conditions, it's important for medical documentation. So you, by saying that, starting with saying I put a lot of emphasis on chronic conditions and making sure that my documentation on my early rotations were very accurate and clear, to be able to connect patients with the proper care that is needed. So during medical school, I always volunteered to do extracurricular activities, such volunteering at local hospitals, volunteering in the COVID zone, volunteering bringing I don't know, vaccination campaigns to the underserved communities. That's great. Then you close that paragraph and say, one of my biggest strengths is to work in a team. I believe that teamwork makes for a better environment and a better something. I don't know. Add something in terms of teamwork that's not cliche, but something that's real. Something that is like when you work on a team, you not only learn more, because as a team, if you are a good team player, you teach more, you learn more, you research more, and you consider your patients in a group. You consider that all patients are yours, not just the ones that are assigned to you, but the ones that your friend has are also yours. Why? Because what if your friend has to go to I don't know, an urgent appointment to see his wife at the doctor, and you are left with his patients in your charge? So because you're such a good team player, you know what's going on with his patients. So one of my biggest strengths is teamwork. And you're not just saying, if you just close there, then that is a deadline. But if you add things like examples of, I believe that teamwork allows you to learn more as you are able to teach more and able to share your doubts or your recommendations to improve the care of a patient. Also, you're able to know more about the patients of all the team. Then I will be like, wow, this guy understands what's going to happen during the inpatient rotations. He knows, he's ready. Then I will also add a line saying, and this is new, but most of the program directors I ask is, if I will find a person that in their personal statement says, what are they really good at? I will be happy enough to focus on that aspect. So for this cycle, for this SOAP process, why don't you say on your personal statement, after you say one of your biggest strengths is teamwork, you could say, I am really good at, what could you be really good at? Clinical documentation, end of life conversations, and antibiotic selection. Then you're good. You could just finish that paragraph, close your personal statement, leave it there, because you gave me the important things. You gave me a little bit of your person, of what made you become a doctor. Then you're happy to add your poetry and all that. Then you gave me why internal medicine, why family practice, by your early interest on chronic conditions. Then you gave me a big thing in internal medicine or family practice, which is teamwork, and why real teamwork, not just words, oh, blah, 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 teamwork. No, you gave me teamwork because I learn more, I teach more, which is important because you're going to have medical students and you're going to have junior residents. And then you also gave me what you're really good at, which is one of the core aspects of internal medicine. History and physical taking, palliative care, clinical documentation, teaching, mentoring. So you give me all these parts, you are making a great personal statement. And that's all what you need. Forget about the rest. Forget about fancy words, synonyms, like I hear all the time, my chagrin, amidst fear, all these crazy words. The simplest your personal statement is the easier it is to read and to engage on it. And again, I would recommend for you to proofread this personal statement by someone that is a professional on this, to add flow and to add correction on grammar. So a good place to go for this is Fiverr, Fiber, and you can find someone that you just Google personal statement, and there will be a list of people that can do it. You choose the cheapest, as long as it's someone that has good reviews and you can get your paper revised, then you're good. There are also doctors that are doing this, so choose one. I would prefer to have it done by a doctor than by a person that is just offering the service. Why? Because they understand more about this process. So good luck, guys, and thank you for watching this video. If you can, subscribe. We'll see you next time.